Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahilladzi arsala rasulahu bil huda wa dinil haq liyudhhirahu 'alad dini kullih wa kafa billahi syahida. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh, amma ba'd. Good morning, ladies and gentlemen. Welcome to opening ceremony of Internasional Seminar at Serbaguna University of Muhammadiyah Kudus, Indonesia. The Excellency Advisory Board of University of Muhammadiyah Kudus, Mr. Sajad, Master of Education. Rector University of Muhammadiyah Kudus, Dr. Edi Susanto, Master of Health. Professor Sin Huo Kuo, Deputy Superintendent of Health and Welfare and Convener, Taiwan International Healthcare Training Center. The Honorable Professor Jin Yesu from Department of Information Management, College of Health Technology, National Taipei University of Nursing and Health Sciences. Professor Wu Fulin, the Director, Department on Infectious Diseases, Taipei Hospital, Ministry of Health and Welfare. Min Xuan Chiang, the Director, International Medical Service Center, Taipei Hospital, Ministry of Health Welfare. The Honorable Vice Rector for Academic Affairs, Mrs. Nur Hidayah, Master of Health. The Honorable Vice Rector for Student Affairs and Cooperation, Mrs. Ani Rosyana Masito, Master of Nursing, Mental Health Nurse Specialist. The Honorable Chairman PKU Muhammadiyah Association of Central Java, represented by the Secretary, Dr. M. Arif Rido, Master of Hospital Management. Head of Aisyah Kudus Regency, Mrs. Eni Alifah Kurnia, Magister of Islamic Education. Board of Director Aisyah Hospital Group Kudus, Dr. Hilal Aryadei, Master of Health. Director Sarkis Aisyah Hospital, Dr. Hendra Oktavianto. Director Aisyah Hospital, Dr. Najib Budi Wardoyo. The Dean of Nursing, University of Muhammadiyah Kudus, and all participants. In the name of Lord, today we are gathering on International Seminar at University of Muhammadiyah Kudus. On Monday, December 4, 2023, ceremony of International Seminar at University of Muhammadiyah Kudus. Let's start this agenda with saying Basmalah together. Bismillahirrahmanirrahim. Singing National Anthem of Indonesia Raya and Sang Surya. Ladies and gentlemen, please all rise. Ladies, ladies and gentlemen, please sit. Well, ladies and gentlemen, please enjoy the Jenang dance. This dance is performed by Asep Siswanto, Ika Fadilal Fajriya, Tri Agustina Damayanti, and Indah Listiana Putri, the student of University of Muhammadiyah Kudus. Please enjoy. Give applause to Dance University of Muhammadiyah Kudus. Ladies and gentlemen, and continue by signing the Memorandum of Understanding PKU Muhammadiyah Association of Central Java with Taipei Hospital Ministry of Health and Welfare. I invite Dr. M. Arif Ridho from PKU Muhammadiyah Association of Central Java and Professor Sin Huoko from Taipei Hospital Ministry of Health and Welfare to come to stage to sign the MOU. I also invite Rector University of Muhammadiyah Kudus, Dr. Edi Susanto, as witness. Okay, take a picture. 1, 2, 3. Freestyle, okay. Next, MOU Asia Hospital with Taipei Hospital Ministry of Health and Welfare. I invite Dr. Najib to come to stage to sign the MOU. I also invite Head of Asia Kudus Regency, Mrs. Aini Alifah Kurnia, Magister of Islamic Education, as witness. Oke, 1, 2. Oke, freestyle. Okay, thank you. You may have your seat, please. Next, MOU Sarkis Asia Hospital with Taipei Hospital Ministry of Health and Welfare. I invite Dr. Hendra Octavianto to come to stage to sign the Memorandum of Understanding. Okay, thank you. You may have your seat, please. Next, giving the souvenir from University of Muhammadiyah Kudus. giving the souvenir from PKU Muhammadiyah Association of Central Java to Dr. M. Arif Ridho. Next photo session, all professor and director rumah sakit. Freestyle, freestyle, okay. Fighting. Okay, next style umku, University of Muhammadiyah Kudus. Okay, thank you very much. You may have your seat, please. Ladies and gentlemen, welcoming remark from Rector University of Muhammadiyah Kudus to Dr. Edi Susanto, Master of Health. The stage is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Yang kami hormati Ketua Badan Pembina Harian Universitas Muhammadiyah Kudus, Bapak Dr. Andes Sajat MPD, The Excellency Prof. Zin Hao Kau, Deputy Superintendent of Health and Welfare and Convener Taiwan International Healthcare Training Center, the Honorable Professor Chen Yeh Zhu from Department of Information Management, College of Health Technology, National Taipei University of Nursing and Health Science, Professor Wu Hulin, the Director Department of Infection Disease, TP Hospital Health and Welfare, and Min Chun Chang, the Director Internasional Medical Service Center, TP Hospital Ministry of Healthcare. Yang kami hormati Wakil Rektor Bidang 1 Ibu Nur Hidayah Eskepnes MKes. Yang kami hormati Wakil Rektor 2 Bidang Administrasi Keuangan Bapak Rizka Himawan MPSI, Wakil Rektor 3 Bidang Kemahasiswaan dan Kerjasama Ibu Ani Rosiana Masitoh MKep SP Kep Jiwa. Yang kami hormati Sekretaris MPKU PWM Jawa Tengah Dr. Ridho. Yang kami hormati Ketua PDA Kabupaten Kudus Ibu Eni Alifah Kurnia MPDI. Yang kami hormati Direktur Rumah Sakit Aisyah Group Kudus Dr. Hilal Aryati MKes. Yang kami hormati Direktur Rumah Sakit Sarkis Aisyah Kudus Dr. Indra Oktavianto. Yang kami hormati Direktur Rumah Sakit Aisyah Kudus Dr. Najib SPOG. Dan yang kami hormati seluruh dekan fakultas yang ada di Universitas Kudus dan seluruh peserta sivitas akademika Universitas Muhammadiyah Kudus dan peserta seminar internasional. I'm sorry Prof. Sin Huaku, I'm use bahasa Indonesia. Jadi Bapak Ibu yang kami hormati, jadi sebetulnya ini momen yang luar biasa karena sebetulnya tamu kita dari HITI-HSTC ini mau datang ke Indonesia. Kebetulan dihubungkan dengan teman kita, Pak Ari. Indonesia mau kemana ya Pak ya? Kebetulan rasan-rasan dengan saya ya bilang, bawa ke Kudus saja, jangan ke yang lainnya gitu. Jadi mumpung kita bisa menjalin kerjasama, sekalian bisa melakukan MOE, kan gitu. Jadi kita bawa ke sini, kebetulan kami bulan Juli itu mencoba menginisiasi kerjasama antara THITC dengan MPKU Jawa Tengah sebetulnya awalnya. Yang seharusnya bulan November kemarin, beberapa direktur, perawat, bidan yang ada di bawah rumah sakit di bawah MPKU itu berangkat untuk mengadakan pelatihan. Tapi karena sesuatu hal akhirnya tidak jadi. Insya Allah ke depan kita akan melakukan pelatihan-pelatihan yang rencananya nanti akan diikuti oleh seluruh tenaga kesehatan mulai dari dokter, perawat, bidan, analis, gizi dan lain sebagainya yang ada di rumah sakit dengan mengadakan pelatihan yang ada di TIHTC tersebut. Karena TIHTC membuat beberapa pelatihan yang bisa diakses oleh kita. Nah, pada kesempatan hari ini kita wujudkan dalam bentuk kerjasama dan insya Allah hari ini nanti para profesor yang ada ini kita beri kesempatan untuk memberikan kuliah pakar di Universitas Muhammadiyah Kudus. Sebisa mungkin semua prodi bisa masuk karena ini merupakan salah satu bagian dari proses akreditasi. Jadi kalau hanya MOU itu tidak akan dilihat oleh asesor, yang dilihat adalah MOU dengan aplikasinya. Sehingga dengan aplikasi inilah mumpung beliau datang ke sini, kita undang kemudian kita puterkan ke beberapa program studi agar semuanya mendapatkan bagian untuk melakukan implementasi dari MOU itu. Dan nanti juga dengan kunjungan ke rumah sakit. Kunjungan rumah sakit nanti kami juga titip Dr. Hila, Dr. Najib, Dr. Indra, selain kunjungan ke rumah sakit nanti kami juga ingin mengimplementasi bagaimana sih workshop bimbingan klinik di rumah sakit. Kebetulan ini beliau ini dari nursing, ada yang dari dokter administrasi rumah sakit khususnya, ada yang penyakit infeksi. Sehingga ini kalau tidak kita manfaatkan secara maksimal eman-eman. Itu. Yang kedua, insya Allah besok kita juga kedatangan tamu dari Malaysia, Prof. Sandep dari mana itu? Lincoln University of Malaysia. Kebetulan besok beliau hari ini jadi narasumber di Unimus, kemudian hari ini mau kita bawa, besok kita bawa ke Omko, harapannya juga bisa memberikan kuliah pakar di sini sekalian. Kebetulan beliau itu ahlinya di metodologi penelitian, sehingga nanti bisa kita manfaatkan di seluruh fakultas yang ada. Nah, ini harapannya 2 hari ini kita akan benar-benar bisa mengimplementasikan dari kerjasama yang kita lakukan selama ini. Saya kira itu yang bisa kami sampaikan. Monggo nanti Pak Safik diterjemahkan sing apik-apik wae. Intinya bahwa kita akan melakukan kerjasama lebih lanjut yang tentunya saling menguntungkan di antara kedua belah pihak. Dan kebetulan MPKU Jawa Tengah ini sekalian ya Pak Ridho ya, punya program satu PDM, ini kebetulan digarisbawahi oleh PWM kemarin habis rapat koordinasi Muhammadiyah, kita diminta satu kabupaten kota harus memiliki 1 rumah sakit dan 5 klinik. Ini tugas MPKU ke depan, sehingga dengan kerjasama ini harapannya membawa semangat lebih jauh lagi dari rumah sakit PKU maupun Aisyah yang ada di Jawa Tengah. Khususnya Kudus sudah luar biasa ini DCI. Terima kasih Bu Eni sama teman-teman di rumah sakit Aisyah yang ada di Kudus. Semoga pertemuan hari ini bisa kita manfaatkan semaksimal mungkin. Saya kira itu yang bisa kami sampaikan, kurang lebihnya mohon maaf. Matur nuwun. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you very much to Dr. Edi Susanto, Rector University of Muhammadiyah Kudus. Ladies and gentlemen, next speech from Deputy Superintendent of Health and Welfare and Convener Taiwan International Health Training Center to Professor Shin Wo-Kuo. The stage is yours.
Honorable guests, Selma Pagi, and good morning. Thank you for joining us on this important moment. On behalf of Taipei Hospital, I would like to extend my warmest greeting to all of you. It's joy to start collaborating with PKU Muhammadiyah Association of Central Java. Taipei Hospital, appointed by Ministry of Health and Welfare, has been dedicated to the execution of Taiwan International Healthcare Training Center, TIHTC, for over 20 years. More than 2,100 health professionals from 80 countries have received training through TIHTC, including over 400 healthcare professionals from Indonesia. Especially during this pandemic, TIHTC collaborated many universities in Indonesia to organize over 20 webinars, inviting experts from Taiwan in healthcare, nursing, health information technology, and hospital management to share their experience online. We would delight to deepen our collaborating relationships and exchange by signing agreement with PKU, Muhammadiyah Association of Central Java. Given the extensive network of more than 52 hospitals and 57 clinics under your association, this agreement marks the beginning of the new chapter of collaboration and aims to strengthen the partnership between our institutions. Lastly, I'm sure today's signing ceremony will be fruitful both sides. Together, let us join hands to enhance our knowledge and skills and improve the quality of health for all. I'm Xianhua Guo, the Deputy Superintendent of Taipei Hospital, Taiwan, also the convener of TIHTC. Thank you.
Thank you very much to Professors in Huoguo. Ladies and gentlemen, the next agenda, Dua to Mr. Sajat, Master of Education. The stage is yours.
Bismillah. Assalamualaikum warahmatullahi wabarakatuh. Bapak Ibu hadirin sekalian, marilah kita berdoa menurut keyakinan agama Islam, sedangkan yang beragama lain silakan dimohon berdoa menurut keyakinan masing-masing. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Allahumma shalli wa sallim ala nabiyyina Muhammadin wa ala alihi wa ashabi ajmain wa ma'hum bi rahmatika ya arhamar rahimin. Alhamdulillahi rabbil alamin. Hamdan syakirin, hamdan naimin, hamdan yuwafi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karim wa azimi sultanik. Astaghfirullahal azim min kulli dhanbin atainahu aw hamamtu bihi. Ya Allah, ya Allah, ya Allah, salli ala habibika wa khalilika wa safiyika Muhammadin wa alihi wa sahbihi wa sallim wa qadhi hajatana wa qbal da'watana wa ajilli bil ijabati ya arhamar rahimin innaka ala kulli syai'in qadir wa bil ijabati jadir. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ladies and gentlemen, those are the opening international seminar at University of Muhammadiyah Kudus. That's all from me as Master of Ceremony. Let's close with saying Alhamdulillah. Alhamdulillahi Rabbil Alamin. Nasrun minallah wa fathun qarib wa basiril mu'minin. Wassalamualaikum warahmatullahi wabarakatuh. Now we come to the main agenda of International Seminar at University of Muhammadiyah Kudus. This will be guided by Mr. Ahmad Nur Syafiq, Master of Education as moderator. The stage is yours. Check. Check all this. Check out.
Check. Taiwan Internasional. Taiwan Internasional. Well, ladies and gentlemen, in a few moments, the international seminar will be started, so please pay attention. Sudah.
Check. Check, check. Check.
Right, so ladies and gentlemen, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, and also a speaker today. Alhamdulillahi Rabbil Alamin, assalatu wassalamu ala rasulillahi ajma'in, amma ba'd. First of all, please let's always praise to Allah subhanahu wa ta'ala because of His mercies and blessings. Of course, today we can run the wonderful activities today, so international collaborations and also international seminar without any obstacle today. Second of all, salawat and salam I always sends to our Prophet Muhammad sallallahu alaihi wasallam, in which at the end of the day we are belonging to his ummah. Right, so the Honorable the Rectors of the University, Dr. A.D. Susanto, and also Vice Rector 1, 2, 3. The Honorable also all beloved speaker today, Professor Hyang Hin Huako, Deputy Superintendent of Health and Welfare, Convener in Taiwan International Healthcare, Professor Shin Ye-shu, Department of Information Management, College of Health Technology, National Taipei University of Nursing and Health Science, Professor Wu Fulin, Director, Department of Infectious Disease, Taipei Hospital, Ministry of Health and Welfare, and also Jessica Xiang, the Director of International Medical Service Center, Taipei Hospital, Ministry of Health and Welfare. The Dean of the Faculty of this university and also Head of the Study Program, and dear participant, beloved today. Right, welcome to the international seminar today. So, to begin the international seminar, so I will let you all to please give a warm welcome to all speakers today. Please give a warm welcome. Give applause to all speakers. I let you to come to stage. Now, please, Professor Shin Wako, Professor Shin Yusef, Professor Wu Fulin, and also Ms. Jessica Xiang, the director. Please come to stage. Okay, now let's begin our international seminar. So as the rector said before in the states that the collaborations between Taiwan International Healthcare Training Center and also Muhammadiyah, so focusedly on PKL Muhammadiyah, is really crucial in the way that we will run some program of such a training and etc. And then in the near future, so hopefully, as the rector said, that we can hold so many agenda and also activity dealing with the training and then the sharing of two countries' conditions of health condition. And today, the topic of the conference will be the recent update of the infection control management in Taiwan hospital. And today's seminar, maybe there are 4 presentations, so including the introductions of Taipei Hospital and also introductions of TIHTC, and then the presentation of the recent update of infections control management in Taiwan, and also we run also a question and answer sessions. Right, so now let's begin our international seminar with saying Basmalah together. Without further ado, so I let the first speaker, also Ms. Jessica Xiang, to open the presentations. The floor is now yours.
Thank you so much. Selamat pagi.
Selamat pagi.
Which one? Okay. Yeah, so first of all, I would like to introduce our Taipei Hospital and our training center. So, next page. Yes. So Taipei Hospital was established in 1968, and which is the MOHW affiliate hospital, and we are going to have our new critical care building in 2026. Next page. And here's our organizational chart. So we are leading by our superintendent, our deputy superintendent, and also we have 41 medical departments, and also nursing departments and medical affairs departments, and 8 administrative departments, and also 27 communities. Next page. So here's our hospital beds, around like 500 beds, and also the employee will be nearly 1,300 staff. Next one. Next page. Okay. Okay, and here's our mission, because we would like to become the model of the hospital of the MOHW affiliate hospital. So we set up so many strategies to implement. So please take a look, and I would like to show you the video of Taipei Hospital. Please play the video. Thank you.
Please play this video, Mas Nur.
like the sound, please?
Please back to the presentation. Thank you. Right now, I would like to introduce our training center, the Taiwan International Healthcare Training Center, which was established in 2002 by our Ministry of Health and Welfare and executed by Taipei Hospital. And we offer the training and also exchange for international healthcare professionals around the world. Next page. And here's our main tests, including the following 5 main tests. And the next page. The most important part is we provide the clinical training. So not only for physicians, nurses, and medical technicians. So we can offer nearly 40 departments of training course. So the period will be around like 1 month to 12 months. And also we cooperate with most of the hospital all around Taiwan. So we can, according to the trainings, their study needs, their study plan. So we arrange them to training in different hospitals. Next page. And here shows our short-term training program. So we have the healthcare management and national health insurance, and also emergency and burn injury management. And the special one in Taiwan is acupuncture and traditional Chinese medicine. And during the COVID, we also have the digital health training program. So we also invite Professor Xu Jianye to be our lecturers. Yeah, also we cooperate with different medical departments in different countries, so we can customize the project training program according to the needs. And here's during their training in Taiwan, so we will have the evaluation, the fully evaluation. And next one. And during their study in Taiwan, we will try to take care of them just like no matter from their arriving in Taiwan and during their training period. And also we will take them to explore the beautiful of Taiwan, and we provide the dormitory for them. And especially in these 2 years, our hospital just get accreditation from Muslim-friendly hospital. And until now, THTC has training over 2,100 international healthcare professionals from 80 countries around the world. And here's our cooperation, especially with Indonesia. We have cooperation with 3 hospitals and 5 universities, and including 3 associations, including Central Java for today and also East Java for 2 years ago. Yeah, and also we cooperate with Mongolia, Philippines, Thailand, Vietnam, and India. And here's during COVID, so we cooperate with Kudus, the hospitals. So we mainly host, and so many people here real in person today. Yeah, so thanks for inviting us. And here's also, we provide some international and medical aids. Yeah, emergency medical aids to help our Ministry of Health and Welfare. Yes. So I would like to show you a video about THTC. What's the clinical training in THTC? Yeah, please take a look.
Show the second video, please.
Hello everyone, this is Dr. Harsh Jakhedia from India. Last year I joined Taiwan International Healthcare Training Center's Dermatopathology Training Program. Wanna see how my life is like in Taiwan? Let's get going. This is our training lab. Let's go. Hello. Good morning. My clinical training consists of routine sign-outs, weekly review of typical and atypical cases on Wednesdays, clinico-pathological conferences on every Thursday, immunofluorescence and electron microscopy reporting, learning from archived slides and cases, and monthly self-assessment and topic tests. Dr. Wu is a great mentor and great teacher. If you have interest in dermatopathology, I would definitely recommend this program.
The level of medical service in Taiwan I think is outstanding. It's very amazing. We also have many medical centers and provide advanced medical care. For the students or the scholars, we have a very good subspecialty training or specialty trainings. For the training of dermatopathology, this is a very subspecialty. Not many training centers can do this job. There is an international committee for dermatopathology. They will accredit the training center in the world. There's only 2 sites in Asia. The site in Taipei, our program is the first accredited program for this ICDP. This is also a major site of Asian Society of Dermatopathology. And I'm the current president of ASD, and we will provide many teaching resources. So if you come to our programs, hope that can help in your future career. Those are from the same cells. It's lunchtime. Lunch. Good break.
I love Taiwanese food so much. Taiwan breakfast restaurants are pretty common and they would be open from early morning till afternoon. I got my choy open. Yay. TISTC is just like my family in Taiwan. We always have fun and celebrate all the special days together. We make rice dumplings during the Dragon Boat Festival. We twerk and dance at the year-end party. We celebrate the Christmas and open the gifts together. We have birthday parties every now and then. Everyone stay safe, stay happy and stay healthy. Thanks to TIHTC, I have experienced almost every aspect of the Taiwanese culture. I would really like to thank TIHTC for giving me such an indelible training experience. Not only do they have a wonderful dorm room, which makes me feel at home, but they also help me find the best hospital for my clinical training. Everything I've learned during my training would be conducive to the reinforcement of my profession.
Congratulations.
Thank you.
on your learning in Taiwan.
Thank you. Thanks a lot. I love Taiwan. I love TIHTC. Your first choice of clinical training platform.
Thank you.
Thank you for your wonderful introductions and amazing presentations, Mrs. Jessica Chiang. And then we now continue the presentation entitled The Recent Update of Infection Control Management in Taiwan Hospital by Professor Wu Fulin. All right, to save our time, now I'll let you to begin the presentation. The floor is now yours, sir.
Selamat pagi.
Selamat pagi.
Okay, good morning, everyone. I am Dr. Upulin, and I'm a doctor from infectious disease, and I'm also major in infection control. And today, I'm glad to be here to share some of our experience. And my topic today is recent update of infection control in Taiwan hospital. And this is the experience from our we are a regional hospital. So. Okay, and first of all, I want to make a brief introduction about the healthcare system in Taiwan. We have three different levels of hospital in Taiwan. The first is medical center, second is regional hospital, and the third is district hospital. For medical center, usually the general bed number is more than 500 beds, and now in Taiwan we have about 22 or 23 medical centers. And for regional hospitals, the general bed number is around between 250 to 500. And also we have more than 22,000 clinics, and it provides good accessibility to our patients because most of the patients can find a clinic close to their home, usually within 15 minutes drive. And we have a national health insurance system, just like you have in Indonesia, and we have a very high coverage, it's more than 99%. So almost everyone are under the same system. So all of our hospitals obey the same regulation. Okay, and okay. And Jessica just introduced our hospital. It's Taipei Hospital, and it's located in northern Taiwan. And we are one of the regional hospitals. So welcome to come to our hospital anytime. And okay, and first of all, sorry, for the infection control, the highest institution in Taiwan is the Center for Disease Control. It's Taiwan CDC. And they publish the guideline and have the infection control inspection every 2 years. And it's a serious event for all the infection control personnel in Taiwan. And just forget to mention that in our hospital, in Taipei Hospital, our infection control team has 3 infection control nurses and also 3 infection control doctors. And 2 are from internal medicine, and one of them, and another is from the pediatric department. Okay, so one of the main tests we have to do is to cope with the infection control inspection performed by CDC every 2 years. And they publish a guideline, which is this one, and it includes more than 170 pages and includes 5 categories. The first one is the implementation of infection control measures. Second is cleaning, disinfection, sterilization of the medical supplies, the environmental cleaning. And the third is about the management of antimicrobial resistance. And the fourth is monitor, notification, and prevention of infectious disease. And the last one is about the employee protection measures. And so we modify our infection control measures in hospital according to this guideline. And the first part I want to mention about the infection control measures after the COVID-19 pandemic. In Taiwan, we had a very strict regulation in order to prevent COVID-19 from entering our community. So we didn't have COVID-19 local outbreaks until last April, when we decided to open our gates just like most of other countries did. And after that, we had a tough time because we experienced a lot of COVID-19 cases. And and we manage it and we counter it, and then we loosen our regulations step by step. And finally, on this March, we formally declare that we open our gates and we loosen most of our regulation on COVID-19. Yeah. And so now we only need to notify COVID-19 cases with complication to our CDC. So, but actually the COVID-19 is still there. For example, last week in Taiwan, we had about 200 COVID-19 cases with complication in Taiwan. And because we just mentioned that almost everyone in Taiwan joined the national health insurance. So everyone has a national insurance card. And when a doctor inserts the patient's card in the computer, then we can get a lot of information from it. For example, we can know what kind of medication the patient is taking, or what lab data the patient had in the past 3 months, or what kind of vaccination had the patient received. And during the COVID-19, next.
The slide of the presentation, please. All right.
Thank you. I cannot count. So next, please.
Next slide, please.
Okay. And during the COVID-19 pandemic, we make good use of our medical system. because we integrate other useful information in this medical system. For example, now when the doctor insert the patient's cards in the computer, then there will be a pop-out window telling us that whether the patient is under isolation or whether the patient just contact with another COVID-19 confirmed test recently. So the information is very valuable because sometimes the patient won't tell the truth to a doctor. And so we depend this information a lot to decide the risk of the patient who is in front of us, the risk of getting COVID-19. And we can use this information to tell us which kinds of personal equipment we should wear. Next one. And so during the COVID-19 pandemics, we know the importance as well as the difficulty to trace the contact of the COVID-19 patient. For example, if one patient in the hospital was diagnosed of COVID-19, then we need to trace anyone who had contact with this patient with more than 15 minutes in the past 2 days. Actually, however, it's very difficult because before we didn't really register the name of the visitor. So we cannot reach out, we don't know who are they. So during the pandemic now, we are asked to do the name-based registration for the visitors in hospital. Anyone who visit the patient in the hospital have to sign up for their name and also leave their phone number. And now most of the hospital use the online system. So if the visitor want to go to the hospital, they need to register online and use QR code and key in their information. And the second, also now we don't isolate COVID-19 patients anymore in the community. If the patient is hospitalized, I mean, if they getting admission to a hospital, we still isolate them for 5 days in order to protect other patients in the hospital. But now we only do the standard precaution to the medical staff, which means we choose our personal equipment depending on what would we do to the patient. For example, if we only want to talk with the patient for a short period of time, then we can only wear surgical mask. However, if you want to do like a sputum suction, or if you want to be enclosed with the patient for a long time, then we still suggest to wear like the gong, the goggle, the N95 mask, and the glove. And also because now is the winter is coming, I know here there's no winter season here. Yeah, but in Taiwan now is winter season. In winter, besides of the COVID-19, we also have the influenza coming every year. Yeah, so now the COVID-19 influenza, the patient have similar symptoms. They all suffer from high fever, the sore throat, the muscle soreness, etc. So now we do the symptom-based screening for all the patients who had the high fever and cough and sore throat. So we screen both the COVID-19 and influenza. And also in hospital, we still ask everyone to wear mask. It's a mandatory mask wearing policy, both for the patient and the medical staff. And if our medical staff got fever, no matter it's due to COVID-19 or not, we ask them to take rest at home, and they can come back for work only after the fever subsides 24 hours later. Next one. And also we try to promote vaccination in order to prevent the big outbreak of the disease. For example, recently our government provides a free influenza vaccine and pneumococcal vaccine for elders and those who have some underlying disease. So now we have a campaign on the poster. We encourage the elders to receive the influenza vaccine on one arm and also on pneumococcal vaccine on another arm at the same day. And besides, we also encourage our elders to receive COVID-19 vaccine, and we provide some money rewards And if we are agree to receive the vaccination, the government also provides a COVID-19 screening test kits for free to encourage to receive the vaccination. Next one. And the second part I want to share about is the antimicrobial resistance in post-COVID-19 era. Because during the COVID-19 pandemic, we all spend our attention and time on COVID-19 prevention. So actually we don't have enough time and manpower anymore to maintain our daily infection control measure. So the antimicrobial resistance is getting higher all over the world, including Taiwan. And our CDC just published the reports about the antimicrobial resistance, and all of you can see that the resistance rate is getting higher, especially after next April in Taiwan. I mean, when we really face a lot of COVID-19 cases. Next one. And one of our strengths in infection control in Taiwan is that our CDC asks any hospital to provide the information about the pathogens of nosocomial infection in their hospital, so the CDC can accumulate the data and provide a seasonal report to tell us that what is the condition of the antimicrobial resistance. For example, in Taiwan, in our ICU of regional hospitals, now the common pathogens, the first one is the Klebsiella pneumonia, and the second one is Candida albicans. Next one. Yeah, and so we have the seasonal reports telling us that for most of the multi-drug resistant bacteria, the resistance rate is getting higher in Taiwan. This is in ICU, but also in our general world. Next one. So one of our new policy is to enforce the CIE control. CIE is one of the multi-drug resistant bacteria, and now we are doing active screening for high-risk groups. For example, if the patient was exposed to broad-spectrum antibiotics, or the patient had a CIE infection before, or if the patient had just contact with other CIE cases, or if the patient got frequent exposure to the healthcare facility. For example, if he received hemodialysis, or he went to the clinic very frequently, then we would do active screening of the CIE by doing the anal swab. And we usually do anal swab to screen for CIE because CIE is a bacteria that usually stay in patients' gastrointestinal tract. So if we do the anal swab, it's easy to find them if there is CIE on patient's body. Next one. And another issue is about the endoscope cleaning. Because from 2015, there are many studies all over the world finding that some people will get CIE because of the contaminated endoscope. For example, if today one patient receives a endoscope examination and the endoscope is not cleaned thoroughly, then there are CIE bacteria remain on the endoscope. Then the second patient receives the endoscope examination, then he will get a CIE infection. Yeah, so it's a big concern all over the world. And recently, our CDC tried to set new SOP about the endoscope reprocessing. And briefly, because endoscope is a very delicate machine, so we need to do the manual cleaning first and do the high-level disinfection. And I think it's a hot topic for infection control now all over the world. Next one. Another issue is about the environmental cleaning, because a lot of studies found that, for example, contaminated sink was found to be one of the CIE sources. For example, if today the sink was contaminated by CIE, there are CIE bacteria on the surface of the sink. When we wash our hands, the water will splash out and contaminate our hands. Yeah, so the environmental cleaning is also one important issue for the multi-drug resistant bacteria control. Next one. And so now we try to train our cleaning personnel or what's the high touch area. I mean, there are some areas in the room where the patient will touch very frequently, and they need to do the cleaning, spend more time to clean these areas. Next one. And before, if we want to evaluate the cleanliness of the environment, we can only depend on our eyes. I mean, we can just watch the surface of the environment, whether it's clean or not. But now we have some new methods to do this. For example, now there is a new assay, a new method called adenosine triphosphate bioluminescence assay. ATP is a chemical product produced by bacteria. So if we detect the amount of ATP on the environment, then we can know the amount of bacteria remains in this surface. So for example, after the cleaning staff just complete their cleaning of the room, then we can swab the surface of an area, and we can detect the amount of ATP. And then we can know the amount of bacteria left, and we can know whether the cleaning staff has done a good job. And we can do the feedback right away. So it's a good method, but it's a little bit expensive. Next one. Another cheaper way to do it is the fluorescent marking. I mean, we can use the fluorescent dye after the patient get discharged and before the cleaning personnel come. We can put the fluorescent dyes, put it on some of the areas in the room. But the cleaning personnel, they don't know it. And after they clean the room, next one, and we can use the ultralight to see how many fluorescent dyes remains. So if a lot of fluorescent dyes remains, it means the personnel staff didn't really clean that area. Yeah, so it's a cheap way, and it's very effective because we can provide the feedback to the cleaning staff right away. Next one. So in our hospital, we introduced this method last year, and in the beginning, the pass rate is very low because they don't know how to clean the fluorescent dye. But after the feedback and the discussion, then now the pass rate can be higher than 80%. So it means the quality of environmental cleaning just got improvement. Next one. And the third part I want to mention is about the injection safety, because on 2014 there was a hemodialysis clinic in Taiwan. They notified several new hepatitis C patients in the same period of time. And CDC found that the outbreak occurred because they reused the needle to treat different patients. Yeah, and the CDC just sets new SOP about the injection safety because of it. So now we emphasize on the injection safety. For example, when we prepare the IV medication, we need to do the sterile operation, and we draw the medication only before the injection. We cannot draw the medication a long time before the injection because it's easy to get contamination. And also, we emphasize that one needle is just for one patient. We cannot share needle to treat different patients because it's easy to transmit some infectious disease. And also, for one bottle of drug, we can use only on one patient. Otherwise, the infection rate will be higher. Next one. And by auditing, actually, we find a lot of error in our daily nursing. For example, we used to prepare the IV medication. We draw it in our syringe in advance and put there, and after several hours, we inject on the patient. But it's dangerous because the drug might be contaminated. So we should not prepare the medication in advance. We should draw the medication right before we do the injection. And also, sometimes we will put the syringe back into the outer packaging. But if you want to do this, then the tip of the needle should be kept outward because we want to protect the syringe from being contaminated. Yeah, so it's some common error we found in our daily nursing practice. And also, again, we should not prepare IV medication in advance because it's convenient, but actually the infection rate of the patient will get higher. So we should avoid this. Next one. And in our hospital, because the bloodstream infection rate increased a lot after the COVID-19 pandemic, so we enforced our injection safety inspection. And after the auditing and inspection, our infection rate decreased almost 50%. So it's an effective way to decrease the bloodstream infection. Next one. Okay, the last part I want to share is about the HIV control in Taiwan. And the new HIV cases every year found in Taiwan decreased since 2017. And part of the reason is that now we have the single tablet regimen, which means most of the HIV patients only need to take 1 pill of medication per day to control their disease. And it's easy, so the compliance is much higher compared to before when they have to take many pills a day. But the real game changer is the PrEP, is the pre-exposure prophylaxis. Next one. Yeah, so for the HIV prophylaxis, we have both pre-exposure prophylaxis and post-exposure prophylaxis. For post-exposure prophylaxis, we call PEP. We use this only in emergent condition, and we usually need to take the PEP within 74 hours after the exposure. However, for PrEP, we use in daily life for those who have some high-risk behavior. And they can do either daily use, which means they can take 1 pill per day to prevent HIV, or also they can do the on-demand use, which means they can take PrEP only when they have some possible exposure of HIV. Next one. And WHO just included PrEP as one of the effective measures for HIV prevention in 2015. And in Taiwan, we have a PrEP pilot program on 2017. And the outcome looks very promising. So we have formal PrEP programs since 2018. And our government provide PrEP for free for those high-risk groups, including people younger than 30 years old and for those partner of HIV cases. And now we have extended PrEP program since 2021. Next one. And outcome of PrEP program in 2021 is very promising because we found that we are not only provide PrEP medication to those high-risk groups, by following up then, we can also provide education about HIV prevention and safe sex, and we can evaluate their mental health. We can do the sexual transmitted disease screening and treatment, and we can also do the referral of the drug rehabilitation and psychiatric clinics. So in 2021, we provide free PrEP to more than 2,000 cases. And the regular screening of HIV rate is more than 95%. And we estimate to prevent more than 80 new HIV cases. So it's very cost effective as a preventive intervention for HIV. Next one. So this year we have an extended PrEP program. If it's a female partner of HIV patient or it's young female group, our government provide a free daily PrEP, which means we provide 30 pills per month for them, but they need to receive follow-up every month. And if it's for male partner of HIV patient or for young male group, we provide free on-demand PrEP, which means we only provide 20 pills per 3 months, and they have to receive follow-up every 3 months. If they want to get extra medication, they still need to pay themselves. Next one. Okay, so it is the last PowerPoint. So hope you have the opportunity to visit Taiwan, and thanks for your attention.
Thank you very much. Now please give a round of applause to Dr. Wu Fulin for the wonderful presentations. Right, so I believe that you participant has in mind to comprehend your understanding about the presentation delivered by Dr. Wu Fulin. Now I let you to invite for the discussion session, question and answer session. And if you have any questions, suggestions, or anything, so you may ask directly to Dr. Wufulit regarding to the infectious disease control. Right? Now please, I invite dear participant. Okay. So, first questions. Raise the hand. Mrs. Ika Tristanti. Okay, you may go to the front. Mrs. Ika, so she is now a doctor candidate, also in midwifery program. Yeah. Introduce yourself and then what the questions will be. Microphone, please. Oh, sini ya.
Thank you, Professor and Doctor. My name is Ika Tristanti. I'm from midwifery program in Universitas Muhammadiyah Kudus. Okay, thank you. Two questions. The first for Mrs. Jessica. I'm very interested in your video about Taipei Hospital. One question, is there a short course for midwife, actually? And what should we do to join the short course? And maybe you can give the information about the short course in Hospital Taipei. And for Professor Liu, excuse me, what do you think about the Mycoplasma bacteria that cause the pneumonia? Mycoplasma bacteria, micro or myco? Mycoplasma bacteria, they cause the pneumonia for the children, and how we can to prevent. Thank you. Thank you.
So first questions from Dr. Candidate Ika Tristanti. So first questions will be to Mrs. Jessica. Is there any short course training in TISTC or Taipei Hospital? And then what should we do to join that course? Mrs. Jessica, would you please give? Okay.
Yes.
Yeah.
And for the first question, actually there are some school in Taiwan will provide this training course, and also the Sun Hospital. So let's, if you would like to attend for this course, so probably let us know like how many students or the lectures, how many lectures. Yes, and we can customize for you according to your needs. Yeah.
Sorry, Mrs. Jessica. So, Ms. Ika, also the requirement, if any, to join that course. Is there any requirement also?
Actually, because it will be like short term of training program. So, if they are students, so it will be better they come as a group. Yes, but if they are lecturers or they are professional already, so they can separate in person. Yes.
Okay. So
Yeah,
thank you, Mr.
I'm from the National Taipei University of Nursing and Sciences. We do have the Department of Midwifery. So yes, as I can remember, the head of department, they also design some kind of short-term class for international students. I can talk to Jessica further if we can provide some kind of this kind of program to international students.
Right. Second question addressed to Dr. Wufulin. So, what is Mycoplasma bacteria and how it's dangerous for the children, and also how to prevent?
Okay, the name of it is a Mycoplasma pneumonia, and it's one of small bacteria. And actually, it usually attacks children with age between 3 to 5 years old, and it seldom causes severe illness on adults. And the infection of mycoplasma pneumonia, actually I think is over around. I mean, there's no high season or no season. And usually the treatment is not difficult because we still have effective antibiotics, and usually the treatment course is about 3 days to 5 days. So in hospital, we still don't really have patients who need to get admission because of mycoplasma. I mean, it's not a common condition for adults, but sometimes in pediatry, yeah, we can find that. And recently, I'm not sure whether there is a epidemic of mycoplasma here, because as I know from the news, there is a mycoplasma like epidemic in China. And I think one of the reasons is that we have a strict regulation or the infection control during the COVID-19 pandemic, so everyone just wear surgical mask. So maybe most of people didn't get mycoplasma infection in the past 3 years. So now most of the people are susceptible to this infection. Yeah, but for me, I'm not really worried about mycoplasma because it's not virus, so it seldom gets a big outbreak, because it's just spread by like aerosol or close contacts. So how to prevention? The prevention is similar to COVID-19. I mean, for our children, they can wear surgical masks when they go to some public area, or I mean, if they have some common cold symptom, just wear a mask to protect themselves. I think it's enough.
Right, thank you for the clear explanation from Dr. Wu Fulin. Hopefully to the questioner, Dr. Iska Tristanti, does it answer the questions? Yes, right, thank you. Now move on to the next question, if any. All right, so, okay, so Dr. Candidate Farid, Ahmad Farid. Okay, please come to the front. Introduce yourself and what's the questions?
Okay, thank you, Prof. Question for Prof. Wu. Yeah, if when fewer and environment factor or environment aspects, Indonesia and Taiwan are two countries have differentiation. Yes, and yeah, two countries. I mean, Indonesia and Taiwan have are two countries have differentiation. Yeah, differentiation. Yes, and then. Oh, sorry, I'm nervous. Sorry. Okay, sorry. Okay, and then. Okay. Apa tadi ya? Okay, right. And then, can the infection control management in implemented hospital Taiwan hospital can be applied in Indonesian hospital? Thank you. I hope you understood my question. Thank you.
Thank you, Dr. Candidate Ahmad Farid. So I get a point. All right, so Dr. Ahmad Farid asked that both of Indonesia and Taiwan are, like different countries with a different management and so many things. And then you explained that the management control of a disease, can it be applied in Indonesia with the diversity, according to you? Can it be implemented, the systems of the disease control?
Yeah, it's a big question. I think you mean the diversity is about the population?
Right, the
diversity?
population, the conditions.
Okay, because in Taiwan, we also introduced most of the infection control measure from United States or Western country. I mean, most of the principles are the same. So the education or the principles about the infection control is universal. And of course, for some details, I think we need to do some modification according to different culture or different system in hospital. So I think it's easier to like, for example, you can, I don't know what kinds of problems you face in the hospital here, and we can just discuss one by one. It's easier. Yeah, because I'm not sure. Of course, something are universal, but some things would be different.
Right, I understand. So Dr. Wufulin also need to know the conditions of hospital in Indonesia, so to see that what is the program can be implemented or not in our country, Indonesia. Right. So does it answer the questions?
See?
All right. Okay, Prof.
I think the other one is we do have a lot of information system built in Taiwan's hospital for infectious control. So that will depend on the data and the information system architectures in your hospital. So if I think the rules like WHO and the education, we are similar. But if we need to implement the system, and many of the system require the information architecture was built here. For example, we need the patient's data from other hospitals, for example. So if the patient comes in, and we probably, because of COVID-19, we will the doctor will know the patient's data from other hospital and the previous data. So that is important. We call this data exchange. So that is also based on the information technology. I think we will share, I will discuss the medical record tomorrow in different hospitals. Yes. Thank you.
It's really clear, the explanations from Professor. Does it answer the questions? All right then. So it will be more and more questions. Is that okay? So because we need to know more information about. Another question, sorry, please. Right, Mrs. Which one? Okay, Mrs. Diana. You can come forward. Would you please provide another microphone, please?
Okay, thank you. Okay, my first question, I'm sorry, I want to introduce myself. My name is Diana. I'm from this program. My first question is dedicated to Mrs. Jessica. According to TIHTC, TITC, it's interesting for me. And are there any scholarship program for Taiwan government to us join to this course? And my second question is proposed to Prof. Wu. Prof. Wu? Prof. Wu. Yes, Prof. Wu. Yes, as you present before, that there any different about subsidy program for HIV protection between men and women. Women, they have 30 pills for a month, and men only 20 pills for 3 months. So what the reason? Thank you.
All right, thank you for the questions. Okay, so all right, you may take a picture first for Mrs. Diana. Okay, all right, thank you. So there are 2 questions. First question addressed to Mrs. Jessica, of course. So is there any scholarship for joining THATC? Right.
Okay, for nursing training, right?
Yep.
Yes. Actually, if they are, the nursing training will be including 2 parts. If for nursing student, so they can come as a group, just like the midwifery. But if for the nurse, they need to have qualified, and also at least 1 year working experience. and we were according to their study needs, like if they are for critical care or they are for internal medicine or a surgical department. So we will arrange they to have the observation in different hospitals, like including medical center or regional hospital. But still depends on what they would like to learn. Yes.
Right, second question is addressed to Dr. Wu Felix. So you say in your presentations that how to treat HIV patients is different. So women, men 20 pills for 3 months, and then for women it's different. Why?
Okay, good question. It's not for treatment, it's for the PIP, it's a pre-exposure prophylaxis for those who at risk for getting HIV, but they are still a healthy person. And as I know, here you also have a PIP program. It's under promotion in Indonesia. I'm also curious about how the details. Yeah, but the reason of the differences is based on the study, because for men, if they took, I just mentioned there are 2 different ways to use PIP. One is daily use, another is on-demand use. And for daily use, the advantage is that the serum concentration of the medication will get steady. So actually it's safer, and the effectiveness to prevent HIV is better. Yeah, but for men, the study shows if they use the on-demand way to take the PIP, then actually the HIV transmission rate will be similar to when they use the daily PIP. So it's based on the outcome of the study. Yeah, for men, they can use with what we say on-demand way of PIP, but the effectiveness is similar. Yeah, so maybe in the future, if there are more study results, maybe one day we can also do the on-demand use for the woman, maybe.
Thank you for the clear explanation. Does it answer the questions? All right, thank you. Okay, now we invite you all. Next questions, if any. Which one? So there will be more questions. Is that okay? Oh, here or there? Which one? Okay, so lady first. Right then. All right then.
Good morning. I'm Yunita from Technology Laboratory Mathematics. I want to question with Dr. Wu. I'm sorry, my question is on the topic implementation. How the implementation of occupationally health and safety in Taiwan hospital. How the implementation of occupationally health and safety in hospital laboratory. Yeah, worker. Rule the laboratory. Maksudnya,
Alright.
Bagaimana undang-undang untuk kalau misalnya tenaga laboratorium itu
the infections from the patient, for example. So what is the law? What is the rule in Taiwan? Is there any specific rule for health worker when they are suffer when they suffer by...
You mean like needle injury or like COVID-19 or...
Yeah, something like that, COVID-19. So when the health worker infected...
yeah, it... Yeah, there are many different aspects. For example, we have some, if our medical staffs are getting like needle injury, I mean they got puncture accidentally when you use the needle, then our law or our government has some, how to say, the subsidy, not subsidy. I mean they can receive the examination and prophylaxis for free. I mean, for PEP, post-exposure prophylaxis, if there is a risk of getting HIV, then our medical workers can get prophylaxis medication for 28 days for free, and also for all the follow-up for free. Yeah, and if really get some infectious disease in the hospital, I think we will provide some like vacation. No. Yeah. Yeah, and basically it depends on whether they break some rules, so they got the infection. If they obey all the infection control rules, but they still get the infection, I think we usually have some way to help them. But if they break some rules, for example, they didn't obey the infection control rules and they get infected, then maybe just treat like a normal patient.
I get it. Does it answer the questions? Bisa ya? All right, thank you. Okay, she understand. Right, next question will be, okay, yeah. So, Mr. Muhammad Johar, please. Pak Jo, all right, you. All right.
Yeah, thank you for this opportunity. Very interesting presentation from Prof. Wu, especially. I would like to ask you about how in these Taiwan hospitals to increase health workers' compliance in carrying out standard precautions so that they can reduce the incidence of hives or nosocomial infection in hospitals. Maybe this strategy can be implemented in the higher education in health, so our students or health students have the habits of standard precaution as well as. Okay, my question is how to improving the compliance healthcare or health workers to standard precautions so we can prevent hives or nosocomial infection in hospital, and this strategy can be implemented in higher education so our students can be implemented or have habits to use standard precaution if they practice in the hospitals. This is for the first questions, and the second questions is about, maybe can you explain about the policies that development in Taiwan about how to prevent antimicrobacterial resistance? As we know that in Indonesia we have policy like the community can to buy the antimicrobacterials in the pharmacies without doctor prescriptions. How about in the Taiwan? Maybe and then how the effectiveness of these regulations or policies in Taiwan?
Right. Okay. I try to point to. Thank you, Mr. Jojo.
Okay.
I try to point out two questions from Mr. Jojo. First will be, what is the standard precaution? Right, precautions in Taiwan that can be implemented for the students when they got field practicings in the hospital, so they are aware about the precautions of a certain disease. And then second questions is, so what's about the policy of the antimicrobacterial resistance? And then Mr. Jojo asked, can it be bought freely or with doctor receipts?
Okay, I think the first one is about how to improve the compliance of the medical workers about standard precaution.
Yeah.
So you mean like we should wear surgical mask or we should do the personal equipment? For our hospital, we do the employee training from the very beginning to tell them what's the basic rules. For example, we need to wear the surgical mask during in the hospital, and we need to protect themselves to prevent patients like if we may be exposed to patients' blood, then we should wear gowns and gloves. Yeah, and I think it's need education. I mean, everyone are afraid of being infected by some infectious disease. So we will tell them we set a regulation because we want to protect you. Yeah, and if they don't obey the standard precaution and then they get some infectious disease, maybe they cannot apply for some rescue or some compensation. Yeah, but basically we also still do, it's like the culture, I mean the hospital culture. If everyone just obey the rule, I think all the newcomers will also obey the rule. Yeah. And also we do the auditing and monitor. One of the job of the infection control nurse is to do the auditing. And also we have the infection control leader in every unit. I mean, they can help us to the internal auditing to tell us, some of the medical stuff they don't wear masks, they don't wash their hands, and we can know who are they, and we can do extra training or use some other methods to do it. And also for the students, and for the short-term student, once they go into the hospital, we'll have a lecture about what's the rules of the infection control. So everyone should obey the same rule. And the second one is about the antibiotics prescription.
Yeah.
In Taiwan, I think we are the same situation. We need the prescription from the doctor to buy the antibiotics.
Right.
So if for mycoplasma, if we need antibiotic, we still need to go to the hospital or clinics. But I think the strength in Taiwan is that we have a lot of clinic, so it's very easy to find a local clinic who can prescribe the antibiotics for the patient. So they don't have to go to hospital and crowded there. But we still need a prescription. It's one way to protect the antibiotics, I mean to control the antimicrobial resistance.
Right.
Okay.
All right. Okay. Thank you for a clear explanation. Does that answer your questions? So that's it. Right. Do we still have more questions? All right. Okay. Which one's gonna be the first? All right. Okay. Okay. Talk tech. I did it well. Okay. So there will be really exciting presentation. So it leads more and more questions. All right.
Yes.
Okay. Come on.
Thank you. My name is Purbawati.
Yep.
From nutrition study program. My question for Dr. Wu, but my question in Indonesian. So,
okay.
Mr.
So she will do in bahasa
translate
Indonesia.
this.
Okay.
Tadi Dr. Wu sudah menyampaikan terkait dengan atau sudah memaparkan bagaimana gambaran rumah sakit di Taiwan terkait dengan fasilitas dan pelayanannya, tetapi saya belum bisa melihat bagaimana pelayanan gizi di rumah sakit, nutrition service in Taiwan hospital, and bagaimana upaya untuk mengendalikan infeksi dalam pelayanan gizi, nutrition service in Taiwan hospital, nutrition service.
Okay. Let me help you to translate. Okay, so is that the question?
Yes.
Is that a good?
Yeah, it's
okay.
enough.
Right. So, okay. Mrs. Purbo asked that.
Thank you. Yeah.
Would you please explain about the health service in Taiwan regarding about the nutrition? So in hospital, nutrition in hospital, and then so how can the nutrition control the spread seeds of disease infection? So can nutrition? I mean. Can the nutrition department control the spread seed of the the infectious disease, right?
You mean from the perspective of infectious disease, doctor?
Yeah.
Did the nutritionist provide help on the infection control?
Okay.
Yeah, of course. And for example, it's not infectious disease, but like for diabetes food. I mean, a lot of infection disease is due to the immunocompromised status of the patient, and good nutritional support would give them better immunity. So like for patients with diabetes in Taiwan, we'll refer them to the nutritionist for the diet education to tell them how to control their sugar. And if they can make a good control, then the infection rate of these patients will be lower. And also from those patients with severe illness, for those hospitalized patients, the nutritional status would have an impact on their outcome. So for example, if for COVID-19, we also have our nutritionists to monitor their NG diet or how many calories they have every day. Yeah, because it's have a lot of impact on their immunity. Yeah, so if they didn't eat well or they have a severe diarrhea, then usually the control of COVID-19, I mean their sickness will be longer. Yeah, so I mean of course nutrition needs to help a lot. Yeah, from the perspective of infectious disease control.
Yeah. Thank you very much. Does it answer the questions? Does it answer your questions? Yes, okay. Just say yes. All right. Okay, and next questions, please. Okay. So, Mrs. Eka Agustina. So, introduce yourself and then what's the point of the question? Because we still have more questions.
Good morning.
Good morning.
Introduce myself. My name is Agustina from Accounting Department. And I want to give you a question about cost services in Taipei Hospital. Maybe out of topics, okay. What is hospital management services in Taipei Hospital, and to reach cost service hospital in improving efficiency hospital operational? Okay.
How to make efficient budgeting right in a hospital?
Yeah.
Efficient. So efficient.
Yes.
All right. So she is asking about finance management in hospital. Finance. So because she is from the accounting, really out of the topic, but if you have any share experience.
我先那个一下。
Okay.
Okay.
Yeah, I can answer part of the questions. If you want to become efficient based on a lot, Okay, you need to control the human resources, you need to control your finance, you need to control the patient safety, and in Taiwan, okay, for example, in Taiwan, we are under the national health insurance. So one way you, of course, efficient. For example, if you are talking about the finance, you need to save some money, right? You need to save money. So one way is, okay, we do have DRGS, so you need to follow DRGS critically because the health insurance will look at your DRG if you follow the DRGS. I believe here is also DRGS. And also, you also need to, for example, you control the resources of medicine. You need to find medicine which is cost effectively. So, well, that is kind of business. So you need to find, follow the regulation of the National Health Insurance. So, and control the usage of your medicine. So that is my opinion. And of course, you need to use the system to maintain the patient safety. Otherwise, to short the length of stay, for example, in your hospital, and that will also save some money. So it's all save money and control your expenditure so that you will not over the national health insurance. It's kind of, yeah. You want to say more about that? Yeah.
All right.
Thank you. It's a big question. Okay, but I think as a deputy superintendent, the most care of myself is keep the high occupation rate and decrease the infection rate and medical dispute and length of stay. The most important strength is the boss, you know? The boss keeping the eyes on everything. And so the labor will become more and more efficiency. That's very short of my reply. Thank you.
Okay, thank you.
Is there any more explanations? Dr. Wu?
Yeah, I mean, one way is to save the expense, and another is to earn more money. So you should do both
Yes,
to
of
make
course.
your budget meet. And so it depends on, you should know, because most of your hospital's income also comes from the national insurance. So you should know what's the rules of the insurance company. How can you attract more patients to come to choose your hospital to receive the treatment, and you can apply more money at the same time, not to expend, not to have too much expense. I mean, it's a principle, but it's very complicated.
Right. Thank you for the clear explanations.
Thank you for your explanation for me.
Okay.
Thank you, sir.
All right. So exactly, the still more questions, I believe, but since now we have a limited time, so I would like to apologize to dear participant who is really curious about this presentation. And once again, so please now give a round of applause to wonderful speaker today for the wonderful material and presentation. So, all right, okay. Finally, we are at the end of this seminar. So after this, I will close this session, and then we will move to the another activities, of course. But to conclude our discussion today, so please, I invite one of the speakers to give a closing statement or recommendation for us relating to the presentation, please. So one of the presenter giving a closing statement.
Okay, so actually the Indonesia just become an official member of the Asia Pacific Association for Medical Informatics. So we will have more collaboration in the future. Thank you.
Okay. Nurses is the most big population in hospital. Always more than 50%, I think. So nurses is our future, I think. And nurses is our power in Taiwan. So welcome to Taiwan, and anything, if you want visit our hospital, visit our TIHTC, have any education and join our education program, and welcome. We will do as we can. Thank you.
And infection control measure is all about clinical practice, so it's very difficult to explain clearly here. So again, if some of you are interested in details, just come to Taiwan and visit us, and we can have more discussion. Okay, thank you.
Thank you very much. And now let's give a last welcome to all speakers today. So finally, we are at the end of this seminar today. I am myself as a moderator, so I'd like to apologize to you all when delivering this international seminar. There are some mistakes. Right then, so finally, that's all the presentation and the seminar today. So I end with saying Alhamdulillah. Alhamdulillah. So thank you. Assalamualaikum warahmatullahi wabarakatuh.